This laser, I believe, has helped management of patients. It is a very simple thing to use. It's also an easy procedure for the patients. More people are hearing about this type of procedure and patients are more open to it. I found that compared with doing previously argon laser trabeculoplasties, that I do the SLT more frequently. It's an easier procedure to do. The patients seem to tolerate it very well. And clinical information about it is that it can be repeated, whereas with an argon procedure there were some limitations and a number of times that you could do the procedure. So I found that I have in fact been treating people with the laser earlier because it is a simpler thing in many respects to do. The patients are very accepting of it, and I know that if it needed to be repeated, it could be done again at a later date. I think that it's a good idea for a lot of reasons. It's good for the patients because it helps improve the glaucoma care for the patients. It's good for the practice because it allows you to treat more patients within the practice rather than referring them away for this procedure. And it's a simple procedure for a general ophthalmologist to do.
Well, the Duet SLT has really made this a treatment of glaucoma patients and patients with posterior capsulotomies more effectively. We're able to more effectively treat them. With the selective laser trabeculoplasty, I think that we've just really been able to simplify the management of glaucoma. And I know a lot of physicians feel that way. With the cost effectiveness and the low side effect profile and the patient, issues of patient compliance, it just really made the management of glaucoma much more efficient. Well, initially, I would say that we did not use this laser as a primary therapy. We used it more as a secondary therapy. But over the past couple of years, and with the increasing research showing that primary therapy with SLT is even more effective than maybe as an adjunctive therapy, we have pushed more towards that direction. So in general, I would say maybe about 40% of patients, 40 to 50% of patients get the SLT laser as a primary treatment, and maybe about 30 to 40% adjunctive, 20% as a replacement, and maybe 10% as repeat. And now that we've had the laser for about 6 years, as we know, some of the effectiveness from the patients initially treated may be wearing off. So I think we'll be doing maybe more repeat lasers here over the next several years. I usually present it to patients as an option. I tell people that there are basically two ways to start the treatment of glaucoma, and it's drops or laser. And when I explain to patients the laser and the drops and what the side effects can be, almost everyone now says they would like to have the laser first. And I think maybe a few years ago it wasn't quite the same, but I also think that people know other people having treatments with laser. And they also understand that, we're telling them, we're being honest with them, we're telling them how we would want to be treated. I always tell patients, if I had this problem, this is something I'd consider first. And I think that helps. I think people understand that. They respect that. The Lumenis SLT has really changed the management of glaucoma for us over the years, in that we are feeling more comfortable about treating patients with SLT as a primary therapy. It's just the side effect profile is wonderful, and patients just really do well and respond well to the treatment. And it's just made the issue of non-compliance with patients, it's helped that problem, because as we know, a lot of patients who are on drops for glaucoma don't follow the regimen as they should, and so it's certainly helped glaucoma from that standpoint. And it's so cost efficient. I mean, this is it's been shown that over the years that you may need drops. If laser has been able to effectively control the glaucoma, that it's much more cost efficient. So for both the patient and for the insurance carriers. Repeatability of the laser was definitely a factor. We feel more comfortable, and some people felt that maybe you could repeat the argon laser trabeculoplasty, but I think most people did not feel comfortable doing that. And with SLT, we've been able to repeat over top of ALT, which is huge because a lot of patients did have that laser in the past. And the success rate with the repeatability has been excellent, so that definitely impacted our decision. I was fortunate to train at the University of Pittsburgh, where they introduced us to the SLT, when I was a resident, and so I got to use it, and I was comfortable with it, and I think that had something to do with why we brought it into our practice so early. But the repeatability was a big factor.
Well, I think the biggest thing has been that we now introduce laser at an earlier time in the treatment. When I first started practicing about 19 years ago, we first started with every single medication that we had, or combination of medications, and then we moved on to, at that time, it was an ALT, argon laser trabeculoplasty, and then we moved on to surgery from there. So what SLT has allowed us to do is now introduce the treatment earlier in the paradigm. So for example, before I add a second medication, I'll always suggest SLT treatment. Or even nowadays, suggesting that as a primary treatment before we start any eye drops. Well, we did actually rent it out for several months before we bought, and to test drive it, and we found that it worked very well. By buying it, we made it a lot more convenient for the patients. They're able to come in now. As soon as we do the exam, we can talk to them about the laser, and they can come in and have the laser done. So I think having the laser here, we've actually been able to offer more procedures to our patients. I think it really does help manage our glaucoma patients better, and I've been extremely happy with it.
Lumenis provided us with the most up-to-date treatment for primary open-angle glaucoma. This treatment eliminates the issues of patient compliance and also provides us with excellent outcomes. Having the convenience of the SLT unit in our office full-time allowed me to consider the option of SLT laser as a primary treatment option for more of our patients. I found that we have greater ease in scheduling and flow of patients in the office. In addition, I find that our patients are better educated as to treatment options that are available, and we're able to provide them with the most up-to-date treatment option available.
Well, the SLT has been a groundbreaking change for me. For example, I've only been introduced theoretically to the SLT laser treatment as a resident in training. And in private practice, I've been able to actually implement this. And not only looking at the data that was provided by Lumenis and doing my own research on data, I've found a lot of personal experience that's allowed me to bring this laser as a first-line therapy. So when I do see a lot of my patients who are very much so an ocular hypertensive patient, or a glaucoma suspect, or a patient who has been treated with eye drops for years on end and not really sure why, I talk to them about the possibility of either eliminating or minimizing the need for eye drops with only about 5 minutes of their time. And then when I tell patients that I can offer them a quick and painless procedure that not only in the end will save them some money, but then also create basically a more healthy tissue in their eye, they usually go for it without question. Whenever I see a patient who are at the borderline of treatment or investigating the possibility of treating either glaucomatous optic neuropathy or ocular hypertension, I always offer them medication or laser trabeculoplasty. So all my patients do have that conversation with me, and ultimately I'll leave it up to the patient to decide which of those two would be a better option, but I do bring it up as an option for every one of those patients. So the Lumenis trio has basically answered a lot of challenges that I see myself as an ophthalmologist, and what I imagine other ophthalmologists see in their practice, is how to provide effective and state-of-the-art but standard of care treatment to patients in an environment where high volume and efficiency really are paramount. Now the laser is a very user-friendly system, so from that standpoint we're able to provide an effective treatment without any inconvenience to the patients. So from my standpoint, efficiency is already taken care of. From a patient standpoint, they want obviously convenience to be a big factor in their treatment. And so the fact that they can do a 2-minute laser treatment to effectively eliminate or minimize the need for eye drops, or also treat any other type of condition, whereas otherwise they may be on months or lifetime of eye drops, they find that a convenience factor worthwhile